This is The Source on Texas Public Radio. I'm David Martin Davies. Even if we weren't in a public health crisis right now, we should be talking about the challenges in our community connected to our older population. Even in the best of times, they're dealing with housing problems, food insecurity, economic hardship, social isolation, and transportation issues. But in this pandemic, where the vast majority of deaths are those of 65 and older, we need to be thinking about the needs of our older population and aging strong now in this pandemic and beyond. Today, we're continuing our series of vital conversations. This one is focused on aging strong through COVID-19 and beyond. This discussion is produced in cooperation with the John L. Santikos Charitable Foundation, a fund of the San Antonio Area Foundation. Vital Conversations is a series of community discussions centered on the San Antonio Area Foundation's 4 impact areas: livability and resilient communities, youth success, successful aging, and cultural vibrancy. In today's topic, Aging Strong Through COVID-19, we'll explore how seniors face challenges with social isolation, transportation, food insecurity, and mental health, and your observations too, as listeners in the community. As you live in the community, what do you see? What should be addressed? Where should we be putting our resources and our attention? Join the conversation. Call in. The number is 833-877-8255, 833-TPR-TALK. You could also email us at thesource@tpr.org and tweet at us at TPRSource. And you can text us at that number, 833-877-8255. Our guest this hour, we're joined by Jane Paccione, Managing Director of Collective Impact for the Successful Aging and Living in San Antonio Initiative, also known as SALSA. Jane Paccione, welcome to The Source.
Thanks for having me.
Also with us, Gloria Vasquez, Director of Aging and Veteran Programs for the Alamo Area Council of Governments, AACOG. Gloria Vasquez, it's great to have you.
Thank you so much. I'm glad to be here.
And Yolanda Perez joins us, Human Services Administrator for the City of San Antonio's Department of Human Services, which oversees and runs our senior centers here in San Antonio. Yolanda Perez, welcome to The Source.
Good afternoon. Glad to be here.
So Jane Paccione at SALSA, Successful Aging and Living in San Antonio. Can you talk about how right now with the COVID-19 and how this has been especially difficult for our senior community? What has changed with your initiative?
Good question. I would say that, let me tell your listeners about SALSA and what it is. It sounds very tasty. We get to do a lot of great work, but we are an initiative with at least 40 organizations, 80 plus people, who focus on the needs of aging adults in the community. So we do focus in the areas of transportation, housing, built environment, caregiver support, and socialization. We are at SALSA informing policy, supporting collaboration, and shifting the narrative around aging, and really celebrating the contributions from our older adult community. The Area Foundation has, along with the San Antonio-Dade County United Way of San Antonio, have established or did establish a COVID response fund for local nonprofit organizations most impacted by the COVID-19 crisis. And because of the strong support that we've received, we were able to support over 200 organizations with a community investment totaling $6.4 million. And I'm happy to say that's made a big difference in our community. So SALSA is here driving, working with nonprofits and others who are in this aging ecosystem to find our way through COVID and get to the recovery phase.
Yolanda Perez with the City of San Antonio's Department of Human Services with the senior centers. When COVID first hit San Antonio, we went into our initial lockdown. The senior centers were also locked down. What's happening right now with senior centers?
Well, Dave, initially when the lockdown occurred, we got the notice on March the 13th, and then March 16th, we had to completely revamp our entire operation. We have 53 senior centers and nutrition centers where we provide services to. So the decision was made that all were closed for all of our public-facing facilities were closed. So we immediately had to implement, first of all, a nutrition service to be able to continue to provide meals curbside and also home delivery, because during the time when our centers are open and we hold congregate settings, we also transport older adults to our centers as well. So we had to completely change our process here. We went into a quick mode of creating curbside pickup and also home delivery of food, commodities, and whatever other resources we had to do. That was the initial thing that was the most important for us to get off the ground immediately. Once this pandemic continued through the summer, there were other needs that our older adults needed in the community, and so it evolved into primary three areas that we started to focus in. One being, of course, the food insecurity. The second being the increased risk of social isolation, and then, of course, we were very concerned about increased instances of elder fraud and abuse. So we started trying to put together all the programming that we could in order to try to address these three efforts with our members and ensure that they were all safe and also receiving the services that they needed.
So Yolanda, obviously the needs of the community did not go away when when your senior centers were forced to go into lockdown. In fact, it seems like those needs increased.
That's correct, and it was kind of one of those things where we had to look at all of this and then try to say, okay, well, yes, we're providing the meals, but we also wanted to ensure, like I said, that we would assist in some way with the social isolation. So we started wellness calls. We've made over 30,000 wellness calls where we're calling up our members. We're talking to them just to check in on them, see how they're doing. We share all different kinds of information with them. We started doing some virtual programming for those that do have access to technology and the internet, but for those that didn't, we had to convert over to paper and started creating, activity booklets, all kinds of different things that we could share with them when they would come by to pick up their meals, or we would go to their homes to deliver their meals. We drop off additional things that might be able to help them to be engaged a little bit more and so forth. So there was a lot of creative ideas that we went into innovation mode, and everyone trying to come up with ideas of how could we best serve our members to ensure that they were receiving what they needed to have in order to get through this time frame.
Innovation requires dialogue. What works, what's not working, what do people need, what needs are out there that aren't being met. We're talking about that this afternoon. If you are part of our senior community, if you have felt the impact, if you have felt the social isolation, what has helped you during this time, what could be provided that you think would be a godsend for you and others in our senior community. The number is 833-877-8255. Also tomorrow at 2 p.m., we're doing a deeper dive on this topic. We're live streaming. You can go to our website, tpr.org, for more information. This is The Source at TPR. Stay with us. Welcome back to The Source on Texas Public Radio, 89.1 FM. I'm David Martin Davies. We're having another one of our vital conversations. We have these time to time in cooperation with the John L. Santikos Foundation with the San Antonio Area Foundation. Today, our area focus is aging strong through COVID-19 and beyond. Our number is 833-877-8255, 833-TPR-TALK. Gloria Vasquez is with us, Director of Aging and Veterans Programs for the Alamo Area Council of Governments, AACOG. Gloria Vasquez, as you work with seniors, you are also dealing with many who are in rural areas in surrounding Bexar County as well, and they have particular needs. What can you tell us?
Yes, we are fortunate that we're able to not only serve Bexar County, but we serve the surrounding 12 counties. And we're able to do that with partnerships within each of those respective counties. Primarily, the biggest need that we kept seeing, and obviously one of the biggest areas that we fund, is nutrition. So we had to work very closely with our partners. As Yolanda Perez mentioned, it really involved turning the key completely on the way operations had been run. They were used to having older adults come into the centers and be engaged in activities, enjoy a new meal, some socialization. COVID took that completely away. So our nutrition providers had to shift gears and be sure that the older adults were receiving and would continue to receive those nutritious meals. In the rural environment, again, it's you don't have as many resources, so number one, they're very limited. So people had to work twice as hard. Our vendors and providers had to work twice as hard to make sure that clients who were in need could get those types of services. One of the things that we have implemented, or that we implemented in the urban and rural, is we had our funder allowed for us to purchase gift cards that were limited to, food purchases and cleaning supply purchases, which, as you know, there was the huge run on cleaning supplies and toilet paper. But we were able to make clients eligible for these gift cards, and they were able to either order online, or if they were able to go into their local grocery store, they could use this additional funding to be able to purchase what they needed. The rural areas are challenged, again, lack of resources, in many instances, the lack of connectivity. There's a huge discussion about broadband opportunities in the rural counties, which is very, very limited in most of our rural counties. So that, again, rural seniors just have it's a double whammy. It's the limited resources, limited transportation, internet connectivity. So, and then the whole isolation, just being apart from even visiting family members. If you're an older adult, you want to be very cautious about exposing yourself to anyone outside of your household. So it really just increased that whole isolation aspect for rural seniors.
Jane Paccione at the Successful Aging and Living in San Antonio, SALSA. We hear a lot about initiatives to support aging in place. Can you talk more about what that means, aging in place, and why is that so important right now?
Well, most older adults want to live in their homes their whole lives, finish out there. So finding affordable, accessible, age-appropriate housing options is a challenge. But at SALSA, we are working on our nonprofits. I just want to shout out to all SALSA nonprofits. Thank you for what you do, and thank you for working on such a deep way for our older adults. But for example, we can do things to help older adults age in place. We can harness technology. We've just heard from Yolanda and Gloria about the digital inclusion. We need to make sure that we can that our older adults have access to the digital platforms that are out there that can help them stay in their homes, home modifications. Also, if you want to age in place, you've got to look at the transportation factor too. If you live in a home right now, is there going to be transportation if you need it and are no longer driving? So there's so much to take into consideration. And our SALSA housing work group is working on a presentation or a workshop that will help outline considerations for staying in our homes as we age.
So, but Jane, as we're dealing with the pandemic and the information that people need to stay safe avoid getting in contact with the virus, wearing a mask, and other information people need about what's happening with this, with this population being particularly in harm's way, because of the high rate of fatalities that we're seeing with COVID-19 and for those 65 and older. So are we doing a good enough job with at least educating this community about what their risks are and how to stay safe?
I think we need to do better. We can do better, but I think we need to, take a step back and say we need to build a greater public understanding of older adult needs and supports and policies designed to address those needs. So I think, some of us look at aging as not such a good thing. Other people look at it as, it's vacation time. We need to change the narrative on how we view aging, because we're all doing it. We're all aging, and we need to prepare our community for people who live into their 80s, 90s, and 100 and plus.
Yolanda Perez at the City of San Antonio's Department of Human Services, you mentioned earlier about the issues of, let me ask you about aging in place. Back to that really quick. How does that aging in place, how does that save actual tax dollars?
Well, from my perspective, the way we look at this is that older adults want to live in their homes. They want to stay in their homes, and obviously this improves their quality of life. It also could improve their physical health. And from that perspective, also it insulates them if they were having to leave their home and perhaps have to move to assisted living or a senior living facility. That's a very large expense for this population, and it also can put them at risk for other types of illnesses that could potentially occur to them.
We've seen these blooms of COVID-19 in these congregate settings of older.
Correct.
And we want to avoid that. So Gloria Vasquez with the AACOG, many people, they still need some health care, but they don't need 24-hour health care. Is there help with people for older seniors who may need some health care, some assistance, but not 24-hour? Who coordinates? Does AACOG help with that?
Our area agencies on aging offer services called personal assistance and homemaker care. You can call us at the Aging Disability Resource Center, and we will, again, ask you some questions about what your needs are, and we can potentially offer services where someone could come into the home and provide personal care to include grooming, maybe a light lunch. But I'll tell you, Dave, one of the things that we encountered during the pandemic was there were those agencies who hire those individuals to go into the home were having difficulty recruiting people to go into the home of elderly people. And then the seniors were also reluctant to have people come in. So it was a very weird scenario because, again, those are two standard services that we've offered for years and years, and it works very well for those who want to age in place and just need a little bit of assistance. But the pandemic greatly impacted, again, the availability of staff that could work in that service area, and the recipient, the individual who was a little reluctant to have someone from the outside come into their home. But yes, those services are available, and we welcome those calls. We were fortunate enough to get some CARES funding from HHSC, and so we were able to expand some of our service areas, again, all in an effort to keep our older adults at home and keep them safe.
And we know that a major cause of concern is falling for many seniors. And Gloria Vasquez at AACOG, are there services that can go into people's homes to do an assessment to see what can be done? Maybe there's a little bit of something that can be fixed, a floorboard or some sort of rickety rail or something that can be done in order to make the home much safer to avoid falling potentials.
Yes, some of those services did change a little bit and were put on temporary hold. Now we're obviously able to go back into the home and do those type of assessments. Some of the assessments were done over the phone, and people could send pictures to us. Again, that involved hiring contractors or service people to go into to those locations to make those kinds of repairs. But the falls prevention, I'm happy to say that we were able to take some of our classes virtual to help individuals minimize the risk of falling. So we've seen a great uptick in that, people signing up for virtual classes where they are led by an instructor who gives them information on how to best structure their household layout, what things to avoid, how to be careful, how to build stronger muscles so that they can avoid falls and, again, continue to live at home and age in place.
Jane Paccione at SALSA, Successful Aging and Living in San Antonio. It seems like we're talking a lot about technology. We have telemedicine. People can use telemedicine to get checkups and talk to their doctors and also help deal with the social isolation and social participation. But older people frequently aren't as comfortable with technology. What can we do with that?
Well, we're lucky enough here in San Antonio to have an organization called Senior Planet that can actually help specifically older adults get connected and stay connected. But I think we really need to think about aging as being a process. But, older adults, this group vary greatly with respect to health, financial situation, or physical abilities. We need to make sure that we are not just looking at the older adult community as just one group. It's got varying levels in there of abilities or financial situation and health.
But right now, Jane, this is a population that seems to be very vulnerable to COVID-19. And then overall, we're having these economic shocks, and we're having squabbles over tax dollars. We don't know because budgets are being busted all over the place. We have to be thinking about what are the available public resources? How can we put them to work and do the most amount of good for this particular community? And so these public discussions, they're I guess figuring that out. Is that what we're trying to do now?
Well, I guess yes, but also, when we look at, let's go back to digital inclusion. We as a community often focus on younger people. We need to include older adults in the conversation so that we co-design with older adults what they need with technology and artificial intelligence to help support independent living.
And how do we do that?
We get people to get involved. People listening today, get involved. Know your neighbors. Call the city. Tell them what you want. That you want to be, included. Serve on a board. Be an aging advocate.
All right.
We need to look after our aging adults.
Okay, and we need to be there are communities, there are boards in San Antonio that are focused on the needs of our senior community, and we need people to participate on that and be advocates. We're going to be talking more about aging strong through COVID-19 and beyond in this vital conversation. Our phone lines are open. The number is 833-877-8255, 833-TPR-TALK. You can also join us again tomorrow at 2 p.m. for a deeper dive into this topic. We're not going to be on the air. This is going to be a live streaming event, and you can join online at tpr.org or go to our Facebook page to find out more. The program today is made possible through collaboration through Texas Public Radio and the San Antonio Area Foundation. What do you want to see happening? How should we be spending our public resources to fortify our senior community? This is The Source. We'll be right back. You're listening to The Source on Texas Public Radio, 89.1 FM. I'm David Martin Davies. Older adults, especially those with medical conditions, have been hit hard by COVID-19 and they need extra support. Those aged 65 and older account for 80% of coronavirus-related deaths, according to the CDC. People 85 and older have the highest risk for severe illness from COVID-19. Many seniors are staying safe by staying home and and social distancing, but now they're at risk of social isolation and loneliness, which can result in depression, anxiety, and other health problems. Fortunately, here in San Antonio, there are many services that are available to help seniors stay safe and socially engaged during this pandemic. These services include food delivery, online exercise programs, and other ways to engage the community and provide telemedicine. If you have questions or comments about how to take part in these services or what you see in your community you want to see some help with, give us a call. The number is 833-877-8255, 833-TPR-TALK. So we're having a vital conversation about that this afternoon in cooperation with the John L. Santikos Foundation and the San Antonio Area Foundation. Yolanda Perez with the City of San Antonio's Department of Human Services, and you run the senior centers. Earlier, you said one of the areas that you've noticed a concern is that elder abuse and elder fraud has been a problem recently with the COVID. What have you seen?
Well, one of the areas that we actually sit on the board with the Adult Protective Services agency here in San Antonio, and so one of the things that we have noticed is a lot of our members are receiving different kinds of phone calls requesting specific information about them, or different kinds of gimmicks that they try to offer them to participate in, which obviously are geared in some way to provide some kind of elder fraud. So we've done quite a bit of trying to educate our members through our wellness calls. We'll call them because we want to know, how are you doing? What's going on? Have you been receiving any kind of calls that maybe don't appear to be legitimate? And so we'll provide them with additional information on how to be able to report these things, or call us, if they need some assistance with something. And then at the same time, we're also putting together resource information that we pass out with our meals when we deliver our meals, or when any of our members come to pick up meals. We'll provide information of what kinds of things to look out for, or give them specific numbers where they can call to seek out any assistance if they feel that they might have been defrauded by any particular gimmicks that people are trying out. So we're trying to keep our members as informed as we can. We recently created a placemat where we included some art that was actually, the art was done by our members at our senior centers, and we took some of that art and created a placemat for their meals, and then on the back of that we incorporated quite a bit of information related to elder fraud tips, what to look out for, and specific numbers where they could call for assistance.
Jane Paccione at SALSA, Successful Aging and Living in San Antonio. We know that there are areas of fraud that are concerning when it comes to housing. Many people, elder Americans, are living in their house, and they're in a legacy neighborhood in San Antonio. There's a lot of gentrification, and people are constantly banging on your door trying to see if you want to sell your home, and then that can be a problem for people who sometimes become homeless, and right now during these economic shocks as well. Are you concerned about this, Jane Paccione?
I think we should all be concerned about this topic. I think that we need to look in our neighborhoods, get out there, connect with each other, and support our older adults in our community where they're at. We need to find out what barriers they're facing and how we can make this community better for everybody.
Let's go to the phone, and the number is 833-877-8255, 833-TPR-TALK if you want to join our conversation about aging strong through COVID-19 and beyond. Ricardo has called in. Ricardo, welcome to The Source. You're on the air.
My concern services are there available for people that have their parents, they're aging, and there's always been a mental issue, and they've been estranged, and you want to get therapy for them. Say, for instance, they have a real bad relationship growing up, but now that they're getting older, the children have to take care of the senior citizens. Say, for instance, they might have been sexually abused or mentally abused or physically abused. Is there services available for both the senior parents and the children, so like that they allow themselves to get the help that they need?
Ricardo, thank you. Thank you for that call. Gloria Vasquez with the Alamo Area Council of Governments, AACOG, services for this very important topic.
Absolutely. We have a large program for caregivers, and so that's where the adult children would come into play because they become caregivers for their parents. We do have telehealth opportunities, mental health through technology that people can join and speak to a licensed professional about these types of issues and get help. And there's also other variety of services where the caregiver is the conduit that we deliver those services through. So the children, the adult children can call in and say, and even if they don't live in the same community, we get calls from people out of state that their parents live here in our region, and we're able to provide resources for them. We're able to direct any type of, it can be anything from, like I said, the mental health to nutrition to transportation, any kind of service. Again, the caregiver does not have to live within this region to call in and request help for their parents or whomever they're caregiving for. We see caregiving of the spouses, one spouse is caregiving for the other, not only in parent-child relationships, but it's pretty extensive, and it really is an area that we are wanting to grow. So, Ricardo, I would encourage you to call us, and when you call, just say that you are a caregiver for your parent and that you would like to see what types of services are available, and we'll provide that information and resources to you.
Yolanda Perez with the San Antonio Department of Human Services Senior Centers. You mentioned social isolation as something that we're trying to deal with right now, and we know that social isolation can amplify the problems of mental illness or even mental cognitive decline and dementia in older people. What's being done in that area?
Well, it's really similar to what Gloria just talked about, but one of the things that we do, as I mentioned, we have been doing the wellness calls, but that's an area also where we talk to them a little bit and we try to find out if they feel that there are any concerns or issues, if they're not feeling well, or if there is something that we can assist them with, then we'll go ahead and work to see if we can find resources for them. And because they are members of our centers, we also have information related to who their family members might be as well. And so if we feel that there might be a concern, we may reach out also to their family members just to let them know that we've been speaking to their older adult family member, and we may have a concern. And then there's sometimes where it might require us to have to file a report with other partner agencies because we want them to maybe go and do a wellness visit to see if they are doing well or if there's any additional services that they might need. So we try to be very thorough, but we also want to ensure that we're protecting their privacy as well. But we do try to determine if there is a need, then we may call family members or we may make a request to have a wellness call or a wellness visit made so that we can ensure that they're okay. And once we make that visit, we might be able to also determine some other issues that may be involved where we can call in some city services that might be able to assist them as well.
And Yolanda Perez, at the City of San Antonio, are we seeing people losing their homes? Are we seeing homelessness, evictions? Is this hitting the older community just like many other parts of our community?
Well, we do have a homeless concern, and there is another division within the city that works that effort. Within our members, I have not seen a large increase, not within our members, but I do know that a homeless situation is an issue as well in San Antonio.
If there is a senior who is not able to maintain the rent or maintain the payments or the tax burden that they have on their home, what do they do, Yolanda?
Well, what they would normally do is they can contact us. We do have a family assistance division as well, and also neighborhood housing services that assist with rent. There are some programs that also may assist with mortgage payments. So if there is a situation like that, they can always call the City of San Antonio, and we will look to see what we can assist with and how we might be able to prevent any of those issues to occur. We also assist with utility payments as well, and again with food, we have food commodities that we can also assist with as well. So there's various services that we can certainly assist with.
And even though you can become a member of the center even today, right?
Oh, absolutely. But we never turn anyone away. Whatever the service may need, it doesn't necessarily mean you've got to be a member of a center. If there is a need that an older adult needs out in our community, we're going to find a way to assist them.
So, San Antonio seniors, we want to hear about your experiences during this pandemic. How are you doing? What has changed? How have you taken advantage of the city or other nonprofit senior services? What questions do you have about assistance that's available to you right now? You can call in. The number is 833-877-8255, 833-TPR Talk. This is The Source on Texas Public Radio. We'll be right back. This is The Source on Texas Public Radio, 89.1 FM. I'm David Martin Davies. Vital Conversations, another one of our series in cooperation with the San Antonio Area Foundation and the John L. Santikos Foundation, talking about aging strong through COVID-19 and beyond. Jane Paccione is the managing director of the Successful Aging and Living in San Antonio initiative, SALSA. So, Jane, we have a lot of great nonprofits in San Antonio, but there's a lot of work that can be done outside of our nonprofits. I mean, should we be looking for our neighbors and our relatives and seeing do go get their groceries for them? Anything we can do to help keep them in their home right now during this highly contagious pandemic?
Yes, of course, being connected will reduce social isolation of our older adults. I've been out in my neighborhood, and I've been chatting to, more engaged than I've ever been in this community. We need to take this crisis and build an opportunity to connect with our neighbors, find out who lives 3 doors down, behind you, to the left, to the right, and if you can help, let's help. And I think San Antonio does a great job. I'm so proud of our nonprofits who have pivoted and really responded to the needs of our older adults in the community.
And Gloria Vasquez at the Alamo Area Council of Governments. So I know you work with all of these surrounding counties, and in these rural areas, one of the biggest problems that people have is transportation. There's not a lot of public transportation, and there's a lot of miles between you and the local Walmart at HEB.
That's correct. And one of the things that we tried to implement, Dave, here at AACOG, we do have a transportation component. It's called Alamo Regional Transit. And so we have been able to schedule rides for seniors to come in from the rural area into San Antonio for doctor's visits, pharmacy, dialysis, things of medical importance. But we're also able to work with smaller communities. And I'll give you an example. In Atascosa County, they've developed a demand response route where people can call in, and it's a fixed route, but it'll pick them up and it goes to HEB, it'll go to the local pharmacy, it goes to Walmart. It's a set route, but they know specific days that they can take that transportation and get to the place that they need to go, in addition to any individualized type of transportation that they might need, again, to a physician's office or another medical type need. So, yes, transportation is incredibly challenged in the rural counties, not just for older adults, but in a general way. It's just very, very limited.
Let's go to William on the phone. William, hi, you're on The Source. Go ahead.
Yeah, thanks a lot for letting me on. I'm on the other side of the ledger, I guess, from the renters. I have a couple of rental properties. I worked hard all my life and gotten them, but this edict by the government that they don't have to pay me rent. And, of course, they understand that clearly. They aren't paying, haven't paid in quite a while now. Where do we get all this help? I hear all this help. I mean, they act like that the only people that can be put out are renters. Folk who own some of these places are dependent on that as an income. We're out there as well,
right.
hanging out, if you will, or can be. So where's the sympathy for us and the help for us? That's the question.
Good question, William. Jane Paccione, SALSA, Successful Aging and Living in San Antonio. I know William's talking about a very complicated issue right now, but we are seeing an economic shock hitting everyone, including many seniors, and they're very vulnerable to these things. What can happen?
Wow, it's a trying time, and I understand completely the gentleman's issue. I guess we just need to keep the communication open. We need to connect with our local government representatives and let them know what we need.
All right, another caller. Let's go to Lee. And Lee, welcome to The Source. You're on the air.
Yeah, I used to live in San Antonio. I live in Comal County, and my problem is transportation. My car broke down, and I don't have a car. And cars are very expensive, and as you know, if you go on one of the, like Craigslist, you can get a piece of junk that'll break down in a week. So why doesn't San Antonio or Alamo City or their county have a car dealership, especially for seniors, that we don't have to haul the car over to a fix-it place because it breaks down and we bought a piece of junk? We're not real good with cars. I can't repair a car. I don't know what's wrong with it, and if it breaks down like my car did, I did have a good mechanic, but it got hauled away. That's it. Now I don't have any transportation because I live in Comal County.
All right, Lee, thank you for the call. Gloria Vasquez, you told us about that at AACOG, how there is a transportation program at AACOG, provides some support, but I mean, when it comes to helping people with their individual cars, is there anything?
It's very limited. We do offer a service called income support, and it's an opportunity for us to help an individual in kind of a unique way. The income support service area is what enabled us to purchase the food gift cards. We can also pay utilities and mortgage assistance out of there, but not really any automotive support. Again, Lee, I would say if you don't have a vehicle but you're looking for transportation, the Alamo Regional Transit really does specialize in the rural areas. Their phone number is 866-889-7433. They're very reasonably priced, but if you're over 65, the Area Agency on Aging can pay for your ride. It's not a taxi service, so they don't pick you up and then take you where you need to go. It's more of a service where several people get picked up within a certain period of time. They go to a location, and then they come back later, pick you up, and take you home. But it is a proven method of trying to get you where you need to go in a safe manner.
I have an email from Rachel. The largest gap between supply and demand in housing in town is for wheelchair accessible housing. I have had neighbors who've had to stay in care facilities after an injury because their houses were not wheelchair accessible. So adapting a home to a wheelchair, Yolanda Perez, are there programs to help people do that?
Yes, I believe there are, and Gloria can probably speak to it better than I can, but we always contact the Alamo Service Connection, and they're able to assist us with identifying agencies that assist in being able to revamp a home in order to allow for a wheelchair access to their homes. So I know that there are some agencies and businesses that will do this. There might be a cost, and there might be some that are able to do it based on how they can assist the older adult. But there are some agencies that are able to do that, and they can always contact, as I mentioned, the Alamo Service Connection, and I believe the number for that is 210-477-3275, and that's an agency that can assist with finding someone that can assist with that kind of work.
Jane Paccione, Successful Aging and Living in San Antonio, SALSA. You seem to be, you're an advocate, you're taking sort of a broad view about what we need to be doing to rethink and change the narrative about successful aging here in San Antonio. Right now, we're not in a good place, but after we get vaccines and we move forward, we need to continue to have these conversations, I believe.
Right. There's a reason why this segment is called Vital Conversations, right? We need to change the narrative. And if we can do that, actually, the Area Foundation, we just graduated 15 trained reframing aging facilitators who will help us improve the public's understanding of aging and better celebrate the contributions of older adults in our communities. So, and hopefully with that changing of a narrative, with that improvement, we can counter ageism and also more supportive policies and programs for all of us as we move through life, because aging is so cool, everybody's doing it.
And Gloria Vasquez at the Alamo Area Council of Governments, AACOG, you guys are providing vital services right now. We're not just vital conversations, but vital services to help people get through these tough days. So what's the number where people can reach out to you again? One more time.
The basic phone number for Bexar County residents is 210-477-3275. Our rural counties can call 866-231-4922.
All right. Thank you so much, Gloria Vasquez, AACOG. Also, Yolanda Perez, thank you for being a rock star at the City of San Antonio Department of Human Services, the Senior Centers. This has been our vital conversation with the John L. Santikos Charitable Foundation, part of the San Antonio Area Foundation. We do have a follow-up program tomorrow at 2 p.m. It will be online streaming. You can go to our website, tpr.org, or our Facebook page to find out more about that. This is The Source on Texas Public Radio. I'm David Martin Davies. Thanks for tuning us in.